You're preparing for surgery now, surgery that's been recommended by your dentist and now confirmed by me. So we're trying to cover all the items necessary and then the best possible scenario where the surgery is going to be an excellent experience for you and we're going to have a successful outcome. There are several things that we do in preparation for your surgery. Some of those are medically related, medication related, things that we ask you to do to prepare your body so you're going to be in the optimum condition on surgery day to have a good experience. The other thing that's really important is for us to help you be relaxed. Because if you're stressed, you have a lot of anxiety coming into the surgery, then that's a negative experience. We don't want this to be negative. This is all about your health and your wellness, and we're trying to create an environment for you that you feel safe, that you feel comfortable, and that you feel confident that coming in on the day of your surgery, you know that my team and I are going to take good care of you. I think the most important thing is trying to create an environment, and a lot of that comes with you getting to know me and my team so that you can be relaxed. So on the day of the surgery, it's natural to have anxiety and to be nervous. And until you're comfortable with me and my team, that's just human nature. So more importantly than anything else is we go through these pre-op instructions and provide you information so that you can feel confident we're going to take good care of you. So we tell you to wear comfortable, loose clothing. Somebody's going to come in with you if you're going to be sedated to be able to take you home, and we just need to know that you're in good hands. So in general, I think that's the most important part of the preoperative instructions that will, I think, give you the confidence that we can bring you in and get things done. What's important is that we get you ready for the surgery. That process begins about 7 days prior to surgery. If you take any aspirin and Plavix, which your physician may prescribe for you, can affect blood clotting. So we would ask you to discontinue those medications. Now, if your physician specifically requests that you stay on those medications, that's a conversation we can have specifically with your doctor, but we want you to discontinue those medications. If you happen to take aspirin in a dosage form of 81 milligrams, it's okay to stay on that up to surgery day. So again, we're focusing on getting your body prepared so that you're ready for surgery. About 4 days prior to surgery, some patients take specific actual anticoagulant medications such as warfarin, otherwise known as Coumadin, or the factor 10A drugs such as Xarelto. It's going to be necessary for you to probably come off of those medications. As your periodontist, I can't ask you to do that, but we will have a consultation or a conversation with your physician so that we can determine what the protocol is if your physician's okay with you discontinuing those drugs, because it's going to be important to discontinue those so that we don't have a bleeding issue during or after surgery. And then finally, on the day of the surgery, there's a few things that you have to be aware of. If you're going to have anesthesia, such as sedation, we have to be sure that you don't eat anything up to 8 hours before the surgery. As far as drinking, you can have some clear liquids up to 2 hours prior to surgery, but nothing after that. If you are taking medications that are prescribed by your physician, we want you to take those medications even on the morning of your surgery. So first of all, that's important. The other thing that makes you an optimum candidate for surgery is that we have you relaxed. And that's one of the reasons why for many of our surgeries, we will actually advise you to have anesthesia, and the anesthesia that I provide is intravenous sedation, and that's for relaxation. So if you're feeling good, we will help you relax, and that's going to create the optimum situation for you. It really depends specifically what type of surgery we're going to be performing. Many procedures that we do probably are in the time frame of 45 minutes to an hour. If you're having a dental implant, for example, typically that's a procedure that lasts about 45 to 50 minutes. An extraction, whether it's complicated or not, and possibly a grafting procedure to rebuild the bone. Same time frame, 45 to 50 minutes. Patients that are having gum surgery, typically that's being done half of the mouth at a time, meaning for example, the upper right and the lower right would be done on the same day. If someone was needing full mouth gum surgery, we would divide the mouth in half and work on one side of the midline. And those surgeries typically take about 90 minutes per side. We do some other more complicated surgeries that may require longer surgery operative times, and we would specifically tell you that before the surgery about how long we anticipate the surgery lasting. What's important for you as a diabetic is that I want you to take your diabetic medication that's prescribed by your physician. And specifically, that's going to be either insulin or an oral pill that you take to lower your plasma glucose or your blood sugar. So I want you to take that medication as it's normally prescribed. However, because of the fact that we're telling you not to eat anything, and specifically solid food, toast and or milk, we don't want you to have that breakfast that day, but we want you to take your diabetes medication. We want you to substitute a carbohydrate equivalent to what you normally eat for breakfast in the form of apple juice or white grape juice. So about 12 ounces of either one of those, apple juice or white grape juice, is equivalent to what you're normally used to eating. So that's important because we need to balance out the carbohydrate intake with your diabetes medication.